These are some of the main reasons for rejected samples and a few things that we can do. So for early repeats, we do recommend that everyone has access to Open Exeter, so you can double check the next test due date if it's not clear on your computer system. So we know that there's issues with passwords sometimes, that the passwords expire. There is a way of using a smart card instead, so your password doesn't expire. So we can share the details of how to do that with you. And we know that Open Exeter isn't being used for most things now. So for URIMS and other things, it has closed down, but it is still being used for cervical screening until we get the new system. So PNLs and next test due dates and all that kind of thing are still on Open Exeter. So do please make sure you still have access to it. And samples that are taken more than 3 months early are considered out of programme, so they will be rejected by the lab. Expiry date. So we have seen quite a reduction in expiry dates rejections because the lab have entered a field, so you can check. But it's really important that you're aware that the amount of time on the vial needs to allow the lab to also do the test. So if the vial expires on the day that you're taking the sample, or in a couple of days after you've taken the sample, then it will have expired by the time the lab get it and by the time they get to do the test. So it's really important that you have at least 14 days, but preferably the turnaround time left on the vial when you use it. So if the turnaround time 7 weeks, then there should ideally be 7 weeks left on the vial when you use it. And then mismatches or unlabeled sample pots. I think the easiest way to avoid this is to ask the patient to check before they leave that the form and the vial is correctly labelled, that it's their details on both the form and the vial, and also asking a colleague to check. So if you've got reception staff or admin staff, just asking them to have a quick look through all your samples before you send them off to make sure that that everything's right and everything matches. I think they're the easiest ways to avoid that. So now I'm going to pass you over to Sarah, who's going to talk to you about Failsafes.
Thanks, Sarah. So all sample takers should have a failsafe in place to ensure that a result is returned for every sample taken. So this could be a list that you keep yourself of samples that you've taken, or in addition to that, it could be that your practice administrator or practice manager sets up a search on the computer system. So that encompasses all samples taken by locum nurses, GPs, practice nurses within the practice to ensure that every woman who's had a test receives a result. And obviously, if there's no result back, then that can be acted upon immediately by the sample taker contacting the laboratory to discuss where that result may be. So it's ensuring that you go back to practice and you're ensuring you've got systems in place to recall patients 3 calendar months or when due where there has been a previous rejection. And again, it's around the laboratory, not the laboratory, sorry, the sample taker or the practice contacting the laboratory if a result is missing and no rejection letter has been received. The onus should not be put on the patient to chase the results. And results, like Sarah said, from the survey show that 20% of sample takers currently don't have fail-safes in place. So it's really important that you go back to practice and ensure that those systems are there to identify patients that haven't received a result. Thanks, Sarah. So in addition, the National Cervical Screening Failsafe Guidance states the maintenance of a register of tests taken, checking that a test result's been received from the laboratory for every sample taken within an appropriate time frame. So that's based on the current turnaround time, making sure all samples are repeated or taken at the correct interval, making sure screening history of all newly registered women at the GP practice is reviewed prior to taking the sample. That's where access to Open Exeter is key so that you can go on and have a look at that last test due date. Making sure that when a test has been rejected by the laboratory, the woman is informed, apologised to and advised regarding repeat testing where appropriate.